What's your biggest gripe when it comes to aesthetics and what you do?
I really do love my jobs. I have a lot of jobs, but I do love them, but they play off of each other. And it just occurred to me when you said that you love wellness. That's what this practice does. It gives me the dichotomy because nobody comes to the ER when they're feeling great. When I go to Bloom the next day, I get to see a whole different ballgame. If I have to pick something with medical aesthetics, that it's relatively unregulated. You have to be careful and just pay attention to who's there and how much physician oversight there is.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here. Well, hello, hello, hello. Hi, everyone. Welcome, welcome, welcome. Welcome to another episode of the Care Room with Dr. Cindy. I have another amazing and awesome guest with us. I don't think she knows how amazing she is to me because our relationship goes back so far, but she was one of my awesome attendings during residency. And I think I've told her this story and I'll share it with you guys too, but our guest today, she was the one who taught me how to suture. It was a busy emergency room because she's an amazing emergency room physician by training. And I was one of the residents of the day. And guys, this emergency room was busy, but we were seeing a patient together. She noticed that, like you can't suture? I think she had asked me to suture, and I said, "Oh, I'm not comfortable doing that." And being the person that she is, with the most big, beautiful heart that she has, with a packed emergency room, she looked at me and she said, "Well, today you're going to learn how to suture." And she sat down with me and went through it step by step. And I can say that actually learned how to suture from Dr. Bridget Flickinger, who's joining us here today. So Dr. Flickinger, in front of, my whole audience, I just want to say thank you because
Okay.
I know you made it such an awesome environment to learn, because I know in medicine, sometimes we are scared to admit when we can't do things because you're supposed to have it all together and be able to do everything. But you made it such an environment that I was happy to be with you and happy to learn. And I learned so much. So in front of my audience, I just want to say thank you.
Oh,
So
you're
thank
welcome. That's amazing. I love it. I
so
just said to a med student the other day, that's funny, that catchphrase. Today you're gonna learn.
exactly. So you
Yeah,
see?
yeah. That's why I was laughing.
Thank you. Thank you for recognizing and doing that. But yeah, thanks for being here. Before we get into everything, I'm just going to let you introduce yourself to the audience and tell
Sure.
us what you do.
Well, I'm a wife of 23 years, I think, three boys, and 19, 16, and 11 right now, all boys. And I am an ER doc by training and went to Penn State, Jefferson Medical College, and then University of Rochester for for residency, no fellowship. And then I'm back to State College because we love it so much, raising our family here. And I'm not burnt out of the emergency department. Everybody keeps asking me if this is my move out of the ED. I do love emergency medicine and I love taking care of people. Maybe not staying up at all hours. I could probably get rid of that someday, but aesthetics is it sort of was a COVID passion project. Really, I didn't understand when I started this training how this was going to take off, but I love it. I love helping people feel better about themselves because it really is their identity and it is it's like their self-esteem. Unfortunately, that is what's, people, how
Yeah,
you present yourself to the world and your self-esteem is tied to that. So helping people build their ego, really. I mean, I hate to say it that way, but that's
it
really
is
what we
what it
do.
is.
It is what it is. Yeah. And aging, I just turned 49 in December. aging is a bear. And if we can make it any more graceful, I think we should. So we
Yeah.
do.
Yeah. Well, thank you for what you do. And you're located in State College, right?
Yep,
Yeah.
we have an office and we are now expanding to what I like to call the big girl office. This was not a pre-built out office. This is a gut job, ground up, everything that I've ever wanted in an environment. So we're excited about that too. It is
Nice,
quite a
nice.
plunge, as we mentioned before, but
Yeah, yeah. And it's needed, right? It's definitely a service that's needed. I love getting glammed up. I do it, rarely. It's a hassle for me. I know people, they see me and they see, when I'm glammed up, but it's not something that I like to do every day.
mm,
But when you
look at
do
me
it,
today.
it makes you feel so much better about yourself.
It
What did you
does.
say?
I said, look at me today. I'm not glammed up today, but yes, I agree. It
Yeah.
does make you present yourself slightly differently to the world, right?
Yeah. Yeah. So tell us a little about what you do. I know when we talk about aesthetics, a lot of people think, oh, like it's just something superficial that, ladies and some men do. But can you tell us exactly what that entails?
Sure. So most of the time in this area, people are not super familiar with what they're looking for. They don't come in with a preconceived plan, which I love to be able to help guide. You come in, you meet with a physician, and we discuss your biggest concerns and your budget, basically, because I don't like people spending money that they're not comfortable spending. And then, we discuss, they'll say these lines, this big spot, whatever is happening. A lot of times now it's jowling. As we get older, that happens. And we will talk about that, often it's a multi-pronged approach and how we deal with it. So often if people are not nervous about it, we talk about Botox and fillers. So Botox is a muscle relaxer that will relax the muscle that pulls the skin to make the wrinkle. Filler is a bit deeper most of the time. It'll be superficial in the lips or superficial sometimes around the perioral lines, but for the most part, we're giving structural support or we're building some sort of sculpture with the filler
Mhm.
to get you back to where you feel comfortable, what you looked like before, a little closer. And there's a lot of tricks to the trade that you are not morphing somebody's appearance. It's really truly still them and you're not making it look like a plastic Barbie doll or something. Yeah.
But
I
if
don't
you
like that.
want to look like a plastic Barbie doll,
Yes.
okay, okay.
You'll have a hard time with me, but yes, I would you would have a hard time convincing me. I know. So I do feel, then there's other layers, like microneedling is a catchphrase that a lot of people hear, but they don't really understand it. So that's really exercising the skin. We're trying to create collagen and regeneration of the skin cells. So I I use the analogy of forest fire, controlled forest fire, where you're forcing the old stuff out and the new stuff to grow, or aerating the lawn. You're poking holes in the lawn just so you can get oxygen and water down deep. And that's exactly what we're doing. And there's lasers and, RF microneedling and fancy things that are possible, skin resurfacing, which we haven't really gotten into yet, um, and chemical peels, but lots of things. But I would like your average consumer to understand that it's not their job. It is their job to be educated and to understand the risks and benefits and who is taking care of them. It is
Right.
not their job, and they don't have to be nervous about going to see somebody if they don't have a plan. It's not their job to have a plan. They need to
Okay.
really collaborate with whoever they're comfortable with making a plan for themselves because, you just want it to be safe and effective and stop where you want to stop so that you don't,
Right.
you can take it really far, obviously, if we've seen in Hollywood, but we don't need to do it all the time.
Right. And fillers for the lips, like is that part of the plan that you do or
Well, it depends. I mean, if you came to see me, I probably would say, "No, you don't need it." You have big,
you
like,
heard that,
nice
guys? I don't need any
yeah,
fillers.
that's right. But yeah, a lot of times people that's their biggest concern, particularly as you age. If you're born with naturally very thin lips, it
Lips.
does not get better as you hit 40, it goes
Yeah.
downhill. So a lot of times just putting a little volume into the lips is great. and it will really take years off, but you can't usually just do that. You have to do a little bit of support back in this direction to make the weight of the lip filler aesthetically pleasing and balanced.
Okay. And it sounds like for you, this is very fulfilling. Do you find that you're seeing a lot of women who have struggled with, their parents and how they look for years? Can you tell us, that side of things, like the emotional side of what you do? Yeah.
I think, just yesterday, somebody jumped up off the table and looked at themselves. I have them stand up and look in the big mirror because the little mirror sometimes doesn't do it justice. And she cried. She cried. And I was like, what is happening? She just
Yeah.
lost 50 pounds. She's been through some really rough and traumatic sort of events in her life, including a divorce,
Yeah.
the loss of a child. And I think this is about finding herself again.
Yeah.
And so those moments really mean a lot to me because it does, people say it's superficial, but unfortunately that is how you regain your identity. You got to do all the hard work. And once you do all of the hard work, it's really disappointing to see, as people say, your face melts, when you lose the weight and you notice the signs of aging. And it is part of life. We're not trying to erase anything. We're just trying to get you back to a place that you feel confident.
Yeah. And I think I know, we it's often, categorized as superficial, but for some people, like you said, whether after, you've had something traumatic happen or you've lost a lot of weight, and I know you do the GLPs too, and we're gonna touch on that. But, I know for me, after going through a divorce and you wanna find yourself again, you wanna look beautiful, you wanna feel beautiful, you wanna feel like yourself again, and you need to be able to go to someone. So I'm so glad that you offer this service and you have that for those women and men who are looking for that. So it's certainly a needed a need. I'm just trying to come against that, this is all superficial, it's for the vain people or the Hollywood stars. No, it's actually a necessary medical service for a lot of people, and it helps, psychologically, emotionally. So thank you for helping those of us who need it on that front.
I think it is a self-satisfying adventure, and
Yeah.
I love the artistry of it, but on the same token, I do think, in our society, and I think in most societies, you're judged on your appearance whether you like it or not, and,
Yeah.
I think that then affects everybody from inside out. And we have lots of post-chemotherapy and radiation therapy patients who definitely don't feel like themselves. Their hair is falling out, and they have, you know, wrinkles or loss of fat or radiation marks or scars. One lady has a big tissue deficit over here, and building that back out again gives them permission to go back out in the world. And
Yeah.
those are the most fulfilling cases for sure.
Yeah. Yeah, I can totally see that. So can you tell us, it sounds like you do a whole body makeover, right? Or you help with that.
Yeah, we help. I'm not a plastic surgeon and I don't play one on TV, but I do. Yeah, we do address a lot of things.
Yeah. So tell us about your work with weight loss.
Well, that comes from a personal journey. Back when I was teaching Dr. Cindy how to suture, I've done a lot of 50-pound weight swings myself. So these GLP-1s have been revolutionary for me. And I started shortly after COVID, I believe. I've been on them probably 3 years now, and it is a slow and steady progression, learning how to deal with it, learning how to keep yourself on track afterwards, or just your maintenance dose, what you're going to do, how you're going to eat. And I still get off track. I mean, I definitely have gained weight over the holidays,
Absolutely.
but I think offering this, I'm just the gateway. I mean, this is a revolutionary drug, and I love being the gateway. We purposefully try to keep this program at a very reasonable cost because the medications are so expensive.
Yeah.
And I really would like to give people access to them. A lot of the local, um, health systems are not prescribing because of the expense and their insurance plans. So they're referring to me and they get the prescription. So, and we are only using the FDA formulations, which I think is important for people to understand the differences, but they're studied and they've been around for a long time. And I think we should be feeling good about the anti-inflammatory effects, the weight loss, the longevity. So that's our stick. I don't have a specific diet that I recommend to people. We talk a lot about weight bearing exercise. We talk a lot about lifting for particularly women and their bone health. And we talk a lot about protein and not just protein. I don't want you to be on, a crazy keto diet or something, but I do ask you simple things like, 90 to 120 grams of protein minimal a day, your water, artificial sweeteners, processed foods, like all those things we just need to start paying attention to.
Yeah, absolutely. And I do the same as well for those patients because it is revolutionary. Like seeing, and it's I keep going back to the psychological effects, but just seeing, and that's why we're here. We want people to be happy and well, and wellness is in different, aspects of life. And it's amazing. I can say that. What are your thoughts on the new, so I know you said, Dr. Flickinger, that you're not doing compounding, right? So you're prescribing the FDA approved meds. There's a new one, right? There's the oral Wegovy now.
Yes.
Have you gotten
And
into that?
well, we have one patient. It just came out last week, so we haven't really done too much with it. But I think as of January 1st, which is just 2 weeks ago, a lot of people have changed their insurance plans. So many of these insurance companies are only covering Ozempic medications. So we have one patient who's gonna venture into the oral formulation. I know my cousin just said she picked up her script the other day for that. I suspect it will be much more accessible to people. I'm excited to see what Eli Lilly comes out with. It won't be tirzepatide, but it is, I don't know how to say it, I'm sorry. I don't have the word right in front of me, but there's a newer one that's not FDA approved yet that's coming out through Eli Lilly.
Okay.
So we'll have to see the risks, the benefits, how people tolerate it. I think that's the key to GLP-1. Some people just simply go too fast, and
Yeah.
some people tolerate semaglutide beautifully, some people not so much.
Yeah. Yeah. And that's where we come in. That's
Yeah,
why hopefully AI won't be taking over our jobs anytime
I
soon.
know, I know. I don't think so. We're just gonna use AI.
What's your what's your biggest gripe? I know we mentioned a few, but what's your biggest gripe when it comes to aesthetics and what you do?
Um, what is my
Or any
biggest I
myth?
don't have too many grapes, to be quite honest, because I love this. There are headaches associated with it, but that's mostly the running the business part of it. The
Okay.
patients in general are quite lovely. I think, personalities still exist. But in my experience with my practice, I haven't come across too many people that I would rather not treat. Sometimes in the emergency department, I'm like, wow, this is an interesting interaction. But people are always in the world either very lovely or very nutty, and there are very few right in the middle, right? But I really do love my jobs. I have a lot of jobs, but I do love them, but they play off of each other. And it just occurred to me when you said that you love wellness, we love wellness. That's what this practice does. It gives me the dichotomy because nobody comes to the ER when they're feeling great. So
Right.
we see a lot of very sick, you know, as I like to refer to it as death and destruction moments, right? And then when I go to Bloom the next day, I get to see a whole different ballgame. And I think the difference between those two practices is really amazing. So not
Yeah.
I don't have too many grapes. I think overfilling is if I have to pick something with medical aesthetics, it's that it's relatively unregulated. There are a number of different degrees out there that are injecting from RN all the way up to facial plastics, where we've got a wide range of people. And I think from the patient point of view and the provider point of view, you have to be careful and just pay attention to who's there and how much physician oversight there is. The goal is to do no harm, right? You don't want to mess up anybody's face. And I
Right.
suppose that's a judgment call if you're looking at somebody's face. But when people look overfilled, they don't I don't think they're feeling good about themselves in general. It's a body dysmorphic sort of picture. I think we as providers or physicians or have an obligation to do no harm.
Absolutely, absolutely. And thanks for that, putting that out there that, it's very important that you know who is doing what and any concerns. I know like there are lasers coming out and every year there's probably a new one, but any concerns in the field aside from who's doing what?
Well, I think we're going to start to move away from traditional fillers most likely. I don't think we'll ever get away from them completely. They're changing. So we have biostimulatory fillers like scalp draft, and I think that's really where the new, in 10, 15 years, that's where we'll be. But the sort of regenerative medicine angle will become a big deal. So laser resurfacing is a beautiful thing, but there's some downtime associated with it, and people need to be careful who's firing their lasers there too. And the weight loss is going to be a huge thing. I think skin tightening, along with that massive weight loss, will be a big deal,
Yeah,
as opposed to the, big surgical scars that people are having now. We'll never get to a point, I don't think we'll get to a point that we can take care of skin that's, 200-pound weight loss that's a surgical
a lot.
procedure, but a little tummy tightening or neck tightening, those are things that I think we're gonna start to be doing on a much less invasive level.
Yeah, absolutely. Oh my gosh, this was so good. Thank you, Dr. Flickinger.
Of
Thank you for
course.
sharing your wisdom.
Thanks for having
So
me on the
if
podcast. This is awesome.
can I not have my former attending who taught me how to suture on the podcast?
That's right. That's right. Here to
So
help.
I know. So if there's someone listening, they really loved what they heard, where can they find you?
Well, we're Bloom MedAesthetics in State College, Pennsylvania. Currently, we are in a downtown location on Allen Street, 315 South Allen, but we're moving over to Creekside Plaza off of South Atherton, which will be the bougie office as we talked about before. I'm very excited about
Yes.
this. Yeah,
I can't wait
really
to
fun.
see the bougie office.
Yeah,
And
beautiful.
social media? Mm,
Bloom underscore MedAesthetics is on Instagram, and it's very Bloom MedAesthetics on Facebook as well.
okay. Perfect. Perfect. Guys, you heard it. She's coming highly recommended from Dr. Cindy. Like I said, she's my former attending. In addition to being an awesome ER doc, an awesome, awesome, awesome esthetician, she is a beautiful person and you don't want a better person taking care of you. I promise you. That's where you want to be. So check out Bloom Med Aesthetics. All right.
Yes. Thank you.
Next week. Next week, I will have another awesome doc on. But until then, take care. Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always, always consult your personalized healthcare provider for medical guidance.